What's up, everybody? I'm Mike Krupa, and today we are going to talk about how to set up a strategic plan if you are an employer and you have a fully insured medical plan. And I get it, it's only about 3 months after January 1st for most employers, and you're thinking, man, the hangover just went away from open enrollment, and you want me to start thinking about next year already? Well, yeah, and I will tell you why. Because the biggest problem employers face in the fully insured marketplace is time. Right? Carriers do not release renewals until about 60 to 90 days ahead of the effective date. And if you're lucky sometimes, right? So like automatically off the bat, you have a set time frame of 60 to 90 days to get everything done you need to get done and have an open enrollment and have your employees go through that process. It just doesn't leave enough time. Making matters worse is brokers sometimes. I was recently talking to a prospective employer and they shared they didn't get their renewal until 30 days before the effective date. How in the world is that enough time to set a strategy, evaluate your options, and have a successful open enrollment with ID cards delivered on the first of the month of the effective date? It is next to impossible. And this is all creating a ton of pain for employers. I can feel the frustration when I am talking to employers about this timing again and again and again. And most of all, I feel the anxiety that they have with the decisions that they're making, right? No time creates a lot of anxiety when you're making decisions. And ultimately, it always ends up in some sort of last minute scramble to get ready for open enrollment. And that's not a good feeling for anybody. But at the end of the day, fear of noise is really one of the biggest things that is holding most employers back from making change. So think about that, right? You don't have a lot of time to make a change if you're getting your renewal 60 days ahead of the effective date. So are you going to make a bunch of drastic changes if you get a really bad renewal? Well, my guess is you're probably less likely to, because you know that there's going to be noise from employees and you don't have enough time to communicate what those changes are, right? So that might keep you in a position where you don't make any changes. And again, that vicious cycle repeats. So I want to give you some tactical things that you can do right now to start getting prepared for your next year's renewal. And those tactical things follow the remodel benefits process, which is establishing control within your health insurance plan, aligning your health insurance plan with partners that have your best interests in mind, and then rewarding employees when you are asking them to make a change. And the first thing that you can do as a fully insured employer is establish some health plan goals. What are you trying to accomplish? What's going to be our guiding principles that guide our strategy? Do you want a tool for attraction and retention? Do you want to offer your employees and their spouses and dependents the best possible care that they can get? What do you want out of your health insurance plan? So start to establish those goals right now. Start thinking about that. Next, I'd argue this might be the most important, is review your data. Go to your broker right now and ask them to review your health insurance data with you. Calendar year 2024 is over. It's a perfect time to review year-end utilization and financials to understand what is going on with your population right now. Because ultimately, that is what is going to help guide your strategy going forward. And I'm telling you to do that right now, right? 9 months ahead of your next renewal. That gives you enough time to think about what your options are, right? Like at its most basic, like who are you going to market? What insurance carriers are you going to go to for the upcoming marketing? Make sure you have set that expectation with your broker. And then what are your plan options? It doesn't mean you have to wait until your renewal to look at plan options. There's some very new innovative designs that are coming out, even in the fully insured space. Those all take time to absorb and digest. Start thinking about them now. And then lastly, I'd say start evaluating different funding arrangements. You know, for some employers out there, fully insured is going to be it, and you may not do anything different ever. But it also doesn't mean you just have to jump right into a self-funded health plan, because many employers are not going to be a fit for self-funding, right? So, but there's other things that you can consider. Maybe it's just a health reimbursement account, an HRA. That's a tiny way to start getting access to some claims data and seeing how employees are behaving. Maybe level funding is an alternative, right? Feels like a fully insured health insurance plan from a payment standpoint. Have the opportunity to participate when there is a surplus in funds in the claims left over, and you get access to more data, right? So start thinking about, is level funding something that you could do? And then finally, again, self-funding, not for everybody, but that allows you to really pick and choose the partners within your health insurance plan and set up some benefits rewards programs. So if there's anything that I would suggest that you do right now, it's these things. Right now, start thinking and planning for next year.